Hi friends, welcome to Classes by Lab Doctor. In today's class, let us understand what are the symptoms of vitamin D deficiency. So हमने हमारे प्रीवियस वीडियोस में देखा कि विटामिन डी क्या है, उसका फंक्शन क्या है, why it is so important in our body and what causes its deficiency. So we studied that the people who are living in high latitude or because of less sun exposure, air pollution, dark skinned people who are on certain medications, could be anti-epileptics, steroids, certain HIV medicines or anti-TB medicines, if there is a liver failure, if there is a kidney disease, chronic kidney disease, nephrotic syndrome, if the person is obese, or if there is any issue with the intestine, or if there is a malabsorption, etc., that can all lead to vitamin D deficiency. And this deficiency can show as some of the symptoms. Okay, so what are these symptoms which we see in vitamin D deficiency? So now you all know that vitamin D is very important for the bone health, for the bone mineralization, bone strength, bone stability, your teeth health, your muscle strength, etc. We can have symptoms related to bones and muscles. Like what are the symptoms related to bones and muscle? Patient can develop osteoporosis. The density of the bone itself is less. The bone becomes very porous. The bone is more prone for fractures. Okay, so that is called as osteoporosis. The amount of bone might reduce. Osteopenia. Whatever bones are there, they might become weak. There is no proper mineralization. That is called as osteomalacia. In children, if there is no mineralization of such bones, that is called as rickets. That can lead to weakened bones. And once the bones are weak, you might develop osteoarthritis. It is also required for the muscle differentiation, for the muscle strength, for the muscle action potential. So patient might develop aches, pains, muscle pain, joint pain. Patient can have this proximal muscle weakness. His gait, his walk might change. His grip, hand grip might become weak. So these are all the symptoms which are related to your bone and muscles. I've told you this is a healthy bone. You can see the matrix here and see here inside how porous it is. This bone is definitely going to break. So this has become so hollow. This has become so porous because there is deficiency of this vitamin D and calcium. The bone is so soft that because of the weight it has bent. This is called as bow legs. This is rickets in children, and in adults softening of the bones is called as osteomalacia. So patient will have bone loss, osteopenia. He will have muscle cramps. Patient will get these cramps in his calf, so that he will be very painful. There is less of calcium and such cramps he will get. Patient always tells there is pain in my leg. I get this cramps. It becomes very hard, painful. I cannot move my leg. That can be because of vitamin D deficiency. He'll have pains. There is pain in the body. There is pain in the bone, in the joints, in the back, in the knee. Everywhere there will be aches and pains. So these are all because of deficiency of vitamin D. Vitamin D, what is there? It regulates the melanocytes, and melanocytes produce skin pigment. Okay, so now when there is deficiency of vitamin D, there can be change in the skin tone. The skin might look little pale. Vitamin D is very important in supporting the immune system. So whenever the immune response is altered, it can affect the skin barrier function, and that can lead to certain condition like eczema, autoimmune disease like psoriasis, allergy. Okay, because this is required to maintain our immune system. It can cause all such symptoms like eczema, itching, pigmentation, allergy, chronic hives can all come because of deficiency of vitamin D. The skin might become dry because this is required for maintaining the skin barrier function. The deficiency of it can also make it dry. It can make it itchy. You can get acne. Okay, so these are all the changes what we see in the skin. Epidermolysis ichthyosis. Such chronic skin conditions can also come when there is deficiency of vitamin D. So vitamin D affects every part of the body. The deficiency इतना वो इम्पोर्टेंट है कि अगर विटामिन डी कम होता है हर एक ऑर्गन इन आवर बॉडी गेट्स अफेक्टेड. सिर्फ बोन और सिर्फ मसल ही नहीं, काफी सारे ऑर्गन्स हैं जो अफेक्ट होते हैं. नाउ वी डिस्कस्ड अबाउट स्किन, वी डिस्कस्ड अबाउट द बोन. It is also associated with the changes in the heart. Okay, agar vitamin D is less, it can lead to variation in blood pressure. It can cause high blood pressure. It can cause coronary artery disease. It can cause fibrosis, myocardial fibrosis. If it is less in the brain, it can cause depression, anxiety. Okay, if there is reduced vitamin D, you are prone to many of the infection, susceptibility to infection. You might be at a higher risk of getting an autoimmune disease. The common flu, your pneumonia, TB, such respiratory diseases might be more whenever there is a risk of low vitamin D. You might be prone to get diabetes because vitamin D has a role to play in the insulin secretion. Also in certain cancers, we have studied that vitamin D has a role. So you might be at a risk of getting some of the cancers when you are less in vitamin D. It is also thought to contribute in the infertility and preterm birth and even in prenatal complication. So you will see that all these organs for a proper मेंटेनेंस एंड फंक्शनिंग दे नीड विटामिन डी. एंड जब विटामिन डी कम होता है ये सारे सिम्टम आ सकते हैं, जस्ट नॉट द बोन्स एंड द मसल, बट यस यू कैन गेट ऑल दिस सिम्टम्स. आपको पता भी नहीं चलेगा, इतना सटल सिम्टम्स रहेंगे. यू मे नॉट इवन रियलाइज दैट दिस आर बिकॉज ऑफ विटामिन डी, बट यस दे कैन be due to vitamin D deficiency. We also have seen that vitamin D is also responsible for the gut health. Vice versa, if there is any gut problem, that can also lead to vitamin D deficiency. It's an inflammatory bowel disease, or there has been a bariatric surgery, or there has been a celiac disease. In सब में क्या होता है, there will be dietary restriction. You cannot eat this, you cannot eat that. So there might be deficiency of vitamin D. Patient might be put on certain treatments like steroids, etc. So that can develop vitamin D. There will be malabsorption. There is inflammation, malabsorption. So you may not be getting in amount of vitamin D. There will be villus atrophy. There will be altered transit of these nutrients. Whenever there is a bariatric surgery, there is no proper channel to absorb these nutrients. So all these can lead to hypovitaminosis. And when there is hypovitaminosis, what happens? Vitamin D itself is responsible for regulation of the gut microbe. It has an immunomodulatory role. It will maintain the epithelial permeability. Because of all these things, what happens? Your inflammatory bowel disease can worsen. So patient can come to you with worsening of the inflammatory bowel diseases. उसका जो भी symptom है, lose motion, diarrhea, indigestion, that can worsen. Vitamin D deficiency can present as an inflammatory bowel disease. So Yes, gut related symptoms can also come. Patient can come with all the gut related issue. Patient can come with constipation, diarrhea, altered constipation, diarrhea. He can have malabsorption, indigestion, bloating. All these symptoms can also occur because of vitamin D deficiency, because vitamin D deficiency and the gut issues are interrelated. So I've told you, whenever there is vitamin D deficiency, patients are more prone for your respiratory infection, allergies, etc. like asthma, wheezing disorders, urticaria, atopic dermatitis, respiratory infections like COVID-19, sepsis, TB, etc. Why? Because vitamin D has a role to play in our immunity. It supports our immunity. It supports both the first line of defense and the adaptive immunity. So whenever there is any virus, bacteria attacking, the innate immunity comes to play within us. So vitamin D supports these. And also at a later date, to remember that virus, bacteria, we need the adaptive immunity, the helper T cells, etc. For that also you need vitamin D. And whenever there is less of vitamin D, you are more prone for all such infections. Your immune system is altered, so you are prone to such infections. And also, in patients who have these autoimmune diseases, we usually see that their vitamin D levels are low. So yes, vitamin D has a role to play in autoimmunity also, and majority of the autoimmune disease, rheumatoid arthritis, SLE, psoriatic arthritis, Sjogren's syndrome, inflammatory myopathies, inflammatory bowel disease, all these patients have low vitamin D. So low vitamin D sometimes can produce as an autoimmune disease also. So that can be the presenting symptom sometime, or worsening of the autoimmune disease if it is already there. So that can also be because of vitamin D deficiency. Vitamin D is very important in maintaining the brain function. It will reduce the inflammation in the brain. It is neuroprotective. It will alter the neurotransmitters. Hence, whenever there is a deficiency of vitamin D, patients sometimes can come with your uh, psychiatric symptoms or symptoms related to your central nervous system. Patient can be depressed. He might be so depressed that there might be suicidal thoughts. Patient can be anxious. He might get panic attack. He might not be able to concentrate. There might be sleep disturbance. So patient can come with any of these symptoms and he might have vitamin D deficiency. Okay, so something like a depression, the reason can be vitamin D deficiency. So yes, vitamin D has a role to play in our brain function. So whenever there is deficiency, patient can also come with such symptoms like depression, suicidal thoughts, inability to concentrate, not able to sleep. This can all be because of vitamin D deficiency. Yes, the diseases related to our brain, the neurodegenerative diseases, neuropsychiatric diseases can be due to vitamin D deficiency. Suppose if a patient is very obese, that obesity can be because of vitamin D deficiency. Obesity can be due to various factors, but one of the factors can be vitamin D. And also, vitamin obesity can lead to low vitamin D. Both of them are interrelated. Okay, when the patient is obese, the fat cell can trap the vitamin D and present as vitamin D deficiency. And whenever there is low vitamin D, there is reduced expression of leptin, or there is decreased calcium, or there is adiposity related gene regulation. There might be a vitamin D receptor polymorphism. All can lead to increased fat and obesity. So patient can be presenting with obesity as one of the symptoms. So that also happens in vitamin D deficiency. Vitamin D is also important for the cardiovascular health. So whenever the patient, he might come to you with a hypertension or a cardiac fibrosis or he might have a cardiovascular disease, blockages, and the cause could be vitamin D deficiency, because vitamin D plays a very important role in cardiovascular health. It is required to reduce the inflammation. If it is less, there will be oxidative stress. It can cause endothelial dysfunction if there is deficiency of vitamin D. It can cause myocardial fibrosis. It can cause cardiac hypertrophy. It can cause systemic hypertension. So patient might be coming to you with a systemic hypertension. Patient might be coming to you with a blockage, and that could be because of vitamin D deficiency also. One of the reason could be low vitamin D also. There are various other reasons, but yes, vitamin D also plays a role in the heart health. So yes, there can be cardiac symptoms. So low vitamin D, we all know that is associated with certain cancers. So maybe patients who are presenting with certain cancers like breast, colorectal, prostate, lung, lymphoma, ovarian cancer, they also will have low vitamin D and they might present with such symptoms. There are other reasons. We are not saying that vitamin D is the only cause, but yes, it can present with such symptoms also, because it has a role to play in the cancer cell genes, or the cancer cell differentiation or immunity support, etc., and hence might present as one of these symptoms also. Vitamin D, you all know that it has a role in glycemic control and lipid metabolism in diabetes, because vitamin D will increase your insulin secretion, and once the insulin is secreted, it will help the insulin to be utilized by the muscles, by the your fat cells. So it will increase the sensitivity to this insulin. It will see that there is reduced lipolysis, etc. So patients who are having less vitamin D, they can come with the sugar being not controlled. There might be poor glycemic control, or the worsening of their glycemic control. So such things can also happen whenever the patient is having low vitamin D. Excessive sweating also can be one of the symptoms, particularly excessive sweating of the head and neck region, because this vitamin D regulates the sweat gland activity, and deficiency of vitamin D can lead to overstimulation of the sweat glands, and that can cause excessive sweating. So these were all the symptoms of vitamin D. One is fatigue, muscle pain, joint pain, muscle aches, body pain, osteoporosis, osteomalacia, rickets, digestive problem, indigestion, loose motion, constipation, etc. Immune impairment, patient is having asthma, he is having allergy, he is more prone to flus, infection, TBs, autoimmune diseases are getting worsened, so something's related to immunity. He might be having dry skin, itchy skin, he might be having acne, he might be having hives, worsening of psoriasis, etc. Patient can develop high blood pressure, he can develop cardiovascular disease, myocardial fibrosis. Patient can have mood swings, he might be depressed, cannot concentrate, he is not able to sleep. The patient's anxiety worsens, he's getting panic attacks. That can be because of vitamin D. Patient can be obese. Patient's diabetes can be worsened. There is no glycemic control. Patient can have excessive sweating. All these can be a symptom of vitamin D deficiency. So these were few of the symptoms which we see in vitamin D deficiencies. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.